All right, and I am going to shut off my video as well. It's just a little less distracting for me as we're talking through these slides. And hopefully everybody can still hear me though.
Sounds good.
And so let's take a look at the topics that we'll discuss today. We're going to take a look at eligibility for retiree health benefits, and separately take a look at eligibility for subsidy to help pay for those health benefits, some things to consider as you're entering retirement or while you're in retirement. We're going to discuss Medicare, how to enroll, some things about what was new in 2025 and continue into 2026. Those items are still relevant, and some next steps. So let's jump into eligibility first. And we are talking about specifically, of course, retiree eligibility for health benefits. And much of that hinges around when you were hired. So as we begin to go through a couple of slides, think about your hire date, and that will help you identify whether you do or don't qualify today. And then what you may need in terms of additional service to qualify as you go through the next several years. So starting with the group that was hired prior to July 1 of 2011, if your hire date fits in that mode, you were hired prior to July 1, 2011, and you plan on retiring directly from your state service. Minimum number of years of creditable service, just 5 years, and or you're approved for a state disability retirement. So that earns you eligibility as a direct retiree. Now, if you were hired prior to July 1, but your retirement is not going to directly follow state service. So what do I mean by that? I mean, you separate from state service, and then 2 years down the road, 3 years down the road, you decide then to come back and start to draw your pension. We would say that your retirement did not directly follow state service. And you'll notice that the eligibility criteria for retiree health benefits does change. So if someone ended state service and had a minimum of 10 years of creditable service and they were within 5 years of normal retirement age, they would be eligible for retiree health benefits. Or if they ended state service with at least 16 years of creditable service, they would be eligible for retiree health benefits. And again, if they're approved for a state disability retirement, eligible for retiree health benefits. So moving on to those hired after July 1 of 2011, the criteria changes a bit. So if you're in that group and your retirement will directly follow state service, you are eligible for retiree health benefits with a minimum of 10 years of creditable service. And again, that state disability retirement. Or if you are hired after July 1 of 11 and retirement does not directly follow state service, eligibility for health benefits equals you ended state service with a minimum of 10 years of creditable service and within 5 years of normal retirement age, or you ended state service now with 25 years of creditable service or that state disability retirement. Thinking about your dependents, the dependents that you had access or were able to cover as an active employee remain the dependents that you can continue to cover as a retiree. Individuals who aren't enrolled under you as a dependent certainly have the option to come on to your plan as you move into retirement. That is fine. So when we're thinking about the relationships involved there, could be your spouse, could be your children under the age of 26, could be another child, other child relative, even grandchildren in some cases do qualify. So there's some eligibility rules about dependents. That's available in detail in the guide. So I'd have you take a look at that. And then, of course, employees who aren't enrolled in health benefits as active employees still have the option to enroll in retirees as long as you meet the eligibility criteria. So once once you meet the eligibility criteria for as a retiree, you don't lose that eligibility, regardless of whether you enroll immediately upon separating state service or not. Doesn't matter. You will retain that eligibility. So now we'll set aside eligibility for the benefits and talk about subsidy. How much subsidy have you earned towards your retirement premiums for health benefits? As active employees, most of us have the maximum level of subsidy towards our benefits. So we're used to the state subsidizing us. About 80% of our premiums are subsidized by the state, and we see about 20% of the cost coming out of paychecks. If you are eligible for the maximum subsidy towards your benefit, that ratio continues on into retirement, and it continues on for your dependents as well. So in retirement, the state will continue to subsidize health benefits coverage for your dependent spouse or your dependent children at the same rate that they are subsidizing you as the retiree. So again, how you earn that maximum subsidy is tied to your hire date. So again, dipping back into the calendar, if you're hired prior to 7/1 of 2011, you earn the maximum subsidy with 16 years of creditable service. If you're hired after July 1 of 2011, you need 25 years of creditable service. Again, if you're approved for a state disability retirement, you automatically are eligible for the maximum level of subsidy that the state offers. But all is not lost if you do not have the years of service to qualify for the maximum subsidy. You are eligible for a prorated subsidy if you are hired, rules around that. If you're hired prior to July 1 of 11 and you have less than 16 years of creditable service, again, hired after July 1 of 2011 with less than 25 years of service, we will prorate the amount of subsidy that you're eligible for, again, tied to the amount of service that you've earned. So if you need if you're thinking about retirement and you know that you don't have the maximum number of years to receive that maximum subsidy, certainly contact the Employee Benefit Division and we are happy to give you an estimate of your costs. At that point, we just ask that you know or have a pretty solid idea how much creditable service you do have and also what your hire date is. We'll probably ask you if you're Medicare eligible or not at the point you plan on retiring, and that helps us give you the best most accurate estimate. So just some things to think about there. So what are some things you should consider when you're planning for retirement that involve your health benefits? Let's talk about the plans that are available to you as a retiree. So currently the state offers 5 medical plans. Each of those medical plans includes a routine vision benefit as well. We've got 2 plans through Care First, Blue Cross Blue Shield, 2 plans through United Healthcare. Both of those companies offer us both a PPO and an EPO. And last but not least, Kaiser Permanente offers us an IHM or integrated health model. For retiree purposes, that Kaiser plan is limited only to those retirees that are not yet on Medicare. So for Medicare folks, you have an option of the 4 plans, 2 under Care First, 2 under United Healthcare. Prescription drug plan right now is under MedImpact. That is only available to non-Medicare retirees. Those that are over the age of 65 or otherwise Medicare eligible will need to enroll in a Part D plan in order to make sure you've got prescription drug benefits as you're moving into retirement. Dental plans, you continue to have access to both United Concordia as well as Delta Dental. Term life insurance is an item that you can carry with you from active employment into retirement without any break in service, no breaks in coverage. So you can carry over your $50,000 or $100,000 policy into retirement. So you would need to be a direct retiree in those cases. It should be noted you can continue term life insurance on yourself, your spouse, your children, if you've got coverage on the last day of employment. Please note that these policies are built so that at specific ages, you will see a reduction in coverage. At age 65, the coverage on your term life insurance begins to reduce. It ends at age 80 with 4 touch points. So age 65, age 70, age 75, and 80. By the time we hit age 80, your initial coverage has reduced to 20% of the initial original amount. So if you started with $100,000 worth of coverage when you retired at age 63, by the time you hit age 80, you're going to be down to $20,000 worth of coverage. Since we're in the middle of open enrollment season right now, and if you're planning on retiring at some point in 2026 and term life insurance is a big item on your list of requirements, this may be a time that you bump up your coverage amount of term life insurance so that at the point of retirement, you start with a higher level of coverage. You do need to have at least one payroll deduction at that higher level of coverage in order for us to be able to carry that over into your retirement. So just give that some thought as you're planning retirement and as you're thinking about open enrollment options. So some items that are not available to retirees. One is flexible spending accounts. You cannot continue into retirement. Again, if you're thinking about retiring perhaps later this year or in 2026, any of your flexible spending accounts that have a balance, you need to incur eligible expenses no later than your last day of employment in order to have those expenses reimbursed. So that those flexible spending accounts do end in terms of incurring new expenses on your last day of employment. You do have 90 days to submit for reimbursement, but there again, you would be getting reimbursed for expenses you incurred no later than that last day of employment. So I hope that that makes sense to you. It helps you plan. Last but not least, accidental death and dismemberment insurance is an option that you don't have as you head from active employment into retirement. You do have the option to convert that to a private policy directly with MetLife. You do have a 30-day period to convert that over if that's something that you want to pursue. So let's go ahead and jump into Medicare. And I know that Medicare is one of the areas where we get a lot of questions from our retirees. We hear a lot about Medicare and the systems, and certainly during this time of year, if you watch television, you are inundated with ads for different plans that support Medicare, whether they're Medicare Advantage plans or traditional supplements, that kind of thing. We are inundated. So let's talk about Medicare specifically, and we're really zeroing in now on Medicare once you are in that retiree status. So of course, Medicare is a federal program. It provides health insurance coverage as the primary insurer for eligible retirees. So if you choose to enroll in the state's medical plans as a retiree who's Medicare eligible, the plan that you enroll in will act as your secondary insurer for you as the retiree and for any Medicare eligible dependents that you will be covering. And that means if you're retired and Medicare eligible due to age, 65, or if you are eligible for Medicare due to disability as a retiree, regardless of age. And then end-stage renal disease would be one criteria that Medicare eligibility affects you regardless of whether you are a retiree or an active employee. But for most of you, your eligibility is going to be tied to age. Some of you may be eligible tied to disability. Less of you are eligible tied to end-stage renal disease. So at that point, if we've determined you're a retiree and we know that you are Medicare eligible based on any of the three criteria, enrollment in Medicare Parts A, which is the hospital benefit, and Part B, which is outpatient services. Those two enrollments are required to have full claims coverage under the state. And then, of course, your medical plan through the state will be acting as a secondary payer to those parts of Medicare. If you fail to enroll in Medicare Part B upon retirement, that is going to land you with responsibility for claims that normally would be paid by Medicare. So as you're thinking about transitioning from active employment into retirement, and you know that Medicare is part of the landscape for you, please contact Medicare. We would recommend about 3 months in advance of your retirement date, and go ahead and discuss getting enrolled so that your Medicare Part B takes effect on the same date as your retirement. That's the perfect scenario. And at that point, you've got full claims coverage because you'll have your Part A and B in place, and you'll have your Medicare supplement in place with the state as well. And you won't get stuck in a bad situation having to pick up 80% of the cost of claims that Medicare should be covering if you so if you didn't enroll timely. So there again, you might have questions about that. Happy to answer those in whatever detail we have time to address, but want to make you aware of that. And last but truly not least is the Part D prescription drug benefit. If you're Medicare eligible in that retiree status, you should enroll in a Medicare Part D prescription drug plan in order to have prescription drug coverage. The state has partnered with a company that partnership was launched last year in 2020. This year, 2025. I'm thinking ahead. Via Benefits is the company that we have partnered with to both assist you to enroll and assist you in choosing and then enrolling in a Part D plan. And we've included Via's number here on the slide, but that is available to you in the guide as well. So Via's contact information is part of the guide to health benefits. So thinking about Medicare Parts A, B, and D enrollment, you will enroll in Parts A and B by contacting Social Security, and you can enroll 3 months prior to your 65th birthday or 3 months prior to your retirement date, whichever is later. Part D enrollment, we would encourage you to contact Via Benefits, and again, same timetable, 3 months prior to your 65th birthday or 3 months prior to your retirement date. Retiree health benefits, as we've said, are secondary to Medicare due to age or disability, and delaying enrollment in Medicare may result in a late enrollment penalty under Part B and under Part D as well. If you have worked past the age of 65 and your employer, in this case, state of Maryland, has continued as your health benefits provider, there again, your penalties for late enrollment are waived when you move into retirement status. There is a Medicare form. It's the CMS form L564. The Employee Benefits Division has these blank copies available directly with us. So we don't need you to send us a copy of the form. We can certainly provide information on that form that can be submitted to Social Security, and any penalties for late enrollment are waived once the Social Security receives that L564. So a couple of things to note: Medicare has several enrollment periods. You have an initial enrollment period that's tied to your date of birth. So if you're turning 65, you've got a 7-month period to enroll. You do have a special enrollment period for Medicare Part B and D. Those special enrollment periods are triggered when you've worked past the age of 65, your employer was continuing to provide your health insurance benefit, and now you're transitioning from active employment into retirement past the age of 65. That will trigger a special enrollment period for enrollment in Part B and D. And then last but not least, there is a general Medicare enrollment period every year, and this is common to all. That occurs between January 1st and March 31st. If you enroll during the general enrollment period, your coverage will take effect the first of the month following your month of enrollment. So if you enroll, you contact Social Security on January 2nd, your coverage will take effect February 1st, just as an example of that effective date of coverage. Medicare Part D, has their open enrollment season going on right now. It started on October 15th. The open enrollment season for Medicare extends a little bit past the states. It goes for an additional month all the way to December 7th. If you enroll during that period, your coverage takes effect January 1. So now you've made the decision, you're ready to retire, you want to claim those retiree health benefits. How do you do that? How do you enroll? You are going to enroll with the Employee Benefit Division on a paper enrollment form. These forms are available either through your HR office. They are also available on our website. So there again, you can complete and submit. We would suggest that you submit through your agency benefits coordinator, who is found in your HR office. That ABC will turn around and submit to the Employee Benefits Division on your behalf. We prefer that simply because that gives the ABC a chance to look over your enrollment form, make sure everything looks correct, is filled out correctly, and so forth. And they basically clear it before we would receive it at the Employee Benefit Division. Just seems to help things go a little bit smoother. And so thinking about where we are for open enrollment right now, and those that are considering retirement, just wanted to point out to you that if you're retiring in 2025, so in these last couple of months of the year, you're going to go ahead and submit that 2025 retiree enrollment form to the Employee Benefits Division. You're not going to take any action on your electronic open enrollment event that should have been launched to you through the SPS or Workday system. If you are retiring January 1, you are going to send us a 2026 retiree enrollment and change form. Again, not taking any action with the electronic event that's in the Workday system. You're transitioning from active employment to retirement January 1. That's going to be a 2026 retiree enrollment and change form. Everyone else that's retiring later in 2026, February 1st, March 1st, you will complete your electronic event in the Workday system. That will pick up your employee benefit for January 1, and then your transition into the retiree system will occur after that. So I hope that that's not confusing. If you've got questions about that, certainly you can contact the employee benefit division directly, or your agency benefits coordinators should be able to help you through that process. Couple of things to be aware of as you're making these changes. Your enrollment opportunities to enroll in retiree health benefits within 60 days of your retirement date. If you have a qualifying event like a loss of other coverage, that would allow you to come in outside of the open enrollment period. And of course, you will continue to have access to the annual open enrollment period as an opportunity to both enroll in retiree health benefits or make changes to your retiree benefits. You'll continue to have access as long as you're a retiree, and additionally your beneficiaries as well. If you're adding new dependents at the time of retirement, you will need to submit all required documentation that supports the relationships of these dependents with the enrollment form. So for most of us, those are going to be certified marriage documents and birth certificates for your spouse and your children. And then reminder again, Kaiser eligibility only available to non-Medicare retirees and non-Medicare dependents. So some things that were new January 1 of 2025, and they continue to take effect or carry on into 2026. MedImpact is our new pharmacy benefit manager. That happened January 1. Most of you or all of you are aware of that. Prescription drug coverage for retirees with Medicare is now available through Medicare Part D plans specifically. That's took effect January 1 of 2025. You can look at our website, dbm.maryland.gov/benefits for wellness activities. They are open to non-Medicare retirees as well as active employees. And there are some information on evidence of coverage that is also available on our website. So what happens next? You've submitted your enrollment forms for retiree health benefits, and your last day of employment's coming. What are some things that you can expect? You might be issued what's called a mandatory retiree retroactive adjustment invoice. That will be issued if we at the Employee Benefit Division were unable to take your first health benefit deduction out of your pension check. So it does happen that our timelines don't line up on that initial check, and we may miss the opportunity to take a pension deduction for your first health benefits deduction. So in that case, we do issue you a bill, and there again with some information attached to it about how to make payment. But then after that initial bill, you'll begin to see that your pension is being deducted for your health benefits. You can expect that you will receive a COBRA notice or a direct pay enrollment form. Don't let that unnerve you. Don't let that cause any panic. You are required to receive a COBRA notice by federal law anytime you are coming out of a group health plan. So it doesn't matter that we're turning around and re-enrolling you as a retiree. That COBRA notice has to be issued to you. So don't let that cause you any concern. Last but not least, If you are retiring or leaving state service very early in the month, it may be that we cannot take a payroll deduction for your last employee health benefit premium, and we may have to issue you what's called a no pay notice. And there again, we're just trying to collect that final payment for your health benefits coverage as an active employee. So those are some things that some of you will not see. Well, some of you will not see either of the billings. Some of you may get one or the other, but you should all receive a COBRA notice. If you're moving at any point in retirement, if you are moving, please remember to alert the Employee Benefit Division of a move. Right now, state retirement and the Employee Benefit Division, we don't share address updates. So you will need to notify both state retirement and then the Employee Benefit Division separately of a move. EBD, the Employee Benefit Division, does require to get the information from you in writing, one. We will accept an email from you, that is fine. You can also complete a personal information change form, also available on our website, and go ahead and email that back to us. You can use regular mail to get that back to us, that's fine. But keeping your address updated with the Employee Benefits Division guarantees that your open enrollment materials come to you timely, your health benefit cards arrive at your home address. Make sure that your explanation of benefits also arrive at your home address. So if you're not keeping us updated on the address, all of those items can get slowed down. So sometimes it seems like a small item, but please remember that as you're moving. And that wraps it up for me. Now, there probably are questions, and I think, Jeannie, that we've planned some question and answer